Right, everybody, welcome. Can you all hear? Right, I've had to come along because I've been muted. I don't know why, so who's in the system? Anyway, welcome to full council of the 23rd of September 2020. This is what I would call a readjustment meeting following the 2nd of September. And I just want to ask members to mind your language, because there was a word or two slipped out from I don't know who last time. We are live, so please, if you're having trouble with your connections, don't sweat. I'd just like to say it's been a privilege for the last 3.5 years to occupy this seat, and I really wanted to finish the term, but as they say, events. So thank you for all your questions, many of them, motions, and I hope I have not let anybody down, especially the people who appointed me to this position. And I wish my successor well. And I'm looking for nominations for the position of business chair. I can see Councillor Susan Dunworth and Councillor Jeff Watson. Who's going first?
Chair, I don't wish to make a nomination for the position of business chair. I merely wanted to thank you for your work whilst in that office and express on behalf of the Labour Group our appreciation for the way you have tried to tackle issues at various times when the behaviours of members have not been as they should have been in council. And you're not as good as our chair of council was, obviously, but you've made a really good stab at it, so thank you.
Well, we can always beg to differ, can't we? Councillor Watson.
Thank you, Chair. I would like to nominate Barry Flux as the business chair.
Is there a seconder for that? Councillor Rupert Gibson. Can you?
Yeah, I second that. Sorry.
That's seconded. Can I ask, is there any other nominations? I cannot see any other nominations. Liam, can I just proceed to announce Councillor?
Well, if you could just seek the broad agreement of the meeting, please.
Right, can we all agree that? On a show of hands, if you're happy with that?
That's agreed, Chairman, I believe.
Anybody unhappy with that? Cannot see anybody. Right.
Okay, thank you. And now to elect a deputy business chair. Can I invite a nomination? I go over to Jeff Watson. Jeff?
Thank you, Chair. I would like to nominate Gordon Stewart as the deputy business chair.
And can I have that seconded, please? Councillor Riddle?
I would like to second that, thank you.
Thank you there. Can I have the broad agreement of the meeting that that is agreed? Hands up, and I don't see, I take it nobody's against that. We'll proceed on that basis. Okay, I carry on onto the agenda, and I go to point 2 on the agenda, which is apologies for absence. Do we have any apologies for absence?
Apologies from Councillor Homer and Councillor Jones.
Okay, Councillor Homer and Councillor Jones. Do I have any other apologies? No, I will leave that as that then. Okay. Point 3, disclosure of members' interests. Does anyone have any interest to declare which they have not done so previously? And use your hand if you need to use that. I'm just looking for hands. I can't see any hands, so I shall move on to the next item on the agenda, which is the appointment of leader. To appoint a leader for the remainder of the ensuing council year. Can I have a nomination, please? Councillor Dodge, you have your hand up. You're silent, so I shall go over to Councillor Sesford instead. Councillor Sesford.
Yeah, hello. Yeah, thanks. I'd like to nominate Councillor Glenn Sanderson for the leader.
Do Do I have a seconder for that? Yeah, I'll go for Councillor Riddle. I saw your hand up.
Yes, I've known Glenn for an awful long time. I think he's a grand chap, and I think he will do a very good job as leader of this council.
Okay, so we have a nomination. Do we have any other nominations for leader? I am not seeing any hands up other than Councillor Seymour, but I think that might have been to Councillor Hill. You've got your hand up. Can I invite you in to speak?
Thank you, Chair. All I'd ask is, it doesn't necessarily name vote, but could I ask in this one that there's a specific chance for members to say whether they're for, against or abstain, please?
I'm going over to Councillor for legal advice on that one to Liam. I assume that's the case.
You could ask the members.
Just a proper vote on it.
Yeah,
Yeah, and we can count those members as we would ordinarily. Chairman.
We can-
Best we can. And
we can indicate that as best we can. Yes. Councillor Dungworth, you have your hand up.
Yeah, sorry, I probably need to speak a bit later, but what was that decision on a named vote? Because that wasn't a very clear answer.
Okay, decision on name vote. I assume we would need further meeting, would we, to indicate that?
Chairman, I don't believe that there was a name vote request, that it was just a general indication as to perhaps the numbers for and numbers against and any abstentions, if I understood Councillor Hill.
Chair, I'll make it simple. I request a name vote.
Okay, that's fine. I think we
need a fifth of those members present.
So I need a fifth of you to put your hand up if you want that.
Probably 13 or so.
Let's do it on the participants.
Yeah.
Do people need to raise their hands electronically? Or
Yes, electronically would help me immensely. Thank you.
Is there a second page? I think we have it, Chairman.
Okay, I'm being told we have that, so I assume we move to a name vote then.
Yes, Chairman.
Okay.
Um,
So it's for, against, or abstain. Is that correct?
Yes, that's correct, Chairman, for the appointment of. Yeah, thank you. For the appointment of Councillor Anderson and obviously against the appointment of Councillor Sanderson and any abstentions. I'll just begin as I would normally, Chairman, if that's okay.
Yeah, sure.
Reading out the names. Councillor Armstrong.
For.
Councillor Bond.
For.
Councillor Bennon.
Bennon, for.
Councillor Bowman.
Abstain.
Councillor Campbell.
Abstain.
Oh, sorry, I've missed Councillor Bridget. Thanks.
Abstain.
Thank you. Councillor Carty.
Abstain.
Councillor Castle.
For.
Councillor Sesford.
For.
Councillor Clark.
Abstain.
Councillor Crosby.
For.
Councillor Dale.
For.
Councillor Daly.
For.
Councillor Davy, Grant Davy.
Abstain.
Councillor Susan Davy. Councillor Susan Davy.
Abstain. Abstain.
Thank you. Councillor
Thank
Dick.
you.
Abstain.
Councillor Dodd. Councillor Dodd is muted. He might wish to raise his hand to indicate that he's, yes, he's got a thumbs up. Thank you. Councillor Dunworth.
abstain.
Councillor Dunbar.
For.
Councillor Dunn.
Abstain.
Councillor Flux.
For.
Councillor Foster.
Abstain.
Councillor Gallagher.
Abstain.
Councillor Gibson.
For.
Councillor Gobin.
Abstain.
Councillor Grimshaw.
Abstain.
Councillor Happel,
Abstain.
Councillor Hill,
Against.
Councillor Horncastle,
For.
Councillor Hutchison,
For.
Councillor Jackson,
For.
Councillor Jones, sorry, apologies from Councillor Jones, Councillor Kennedy,
For.
Councillor Lang,
Abstain.
Councillor Laurie,
For.
thank you, Councillor Ledger,
Abstain.
Councillor Murray,
For.
Councillor Nesbitt,
Abstain.
Councillor Oliver,
For.
Councillor Parry,
Abstain.
Councillor Pattison,
For.
Councillor Purvis,
Abstain.
Councillor Quinn,
For.
Councillor Reid,
Abstain.
Councillor Renner Thompson,
For.
Councillor Richards,
Abstain.
Councillor Rickerby,
Abstain.
Councillor Riddle,
For.
Councillor Robinson,
For.
Councillor Roughhead,
For.
Councillor Sanderson,
For.
Councillor Seymour,
For.
Councillor Sharp,
For.
Councillor Simpson,
Abstain.
Councillor Stewart,
For.
Councillor Stowe,
For.
Councillor Swinburne,
For.
Councillor Swithenbank,
Abstain.
Councillor Thorne,
For.
Councillor Towns,
For.
Councillor Wallace,
For.
Councillor Watson,
For.
Councillor Wearmouth,
For.
Councillor Webb,
Not here.
still not here. Still not here. Councillor Webb not present. Councillor Wilson,
Abstain.
thank you, members. Bear with me a second.
Councillor Dungworth, did you have your hand up? You're on mute.
Yeah, but it's not in relation to the vote, so sorry to confuse it on
No,
that.
no problem. I just wanted to check.
Barry, can I just check my mic's working?
It is working now, Richard, yes.
Thank you, got it going.
6 for, 1 against.
What a shame.
Okay, the vote is here. There's 36 for that, 1 against and 26 abstentions. So I declare that Councillor Sanderson is now the leader of the council, and I'd invite him to address the council meeting now.
Thank you very much, Mr. Chairman. It is a great honour. Some might think it's a poison chalice, but for me, it is a great honour. But every councillor, every county councillor involved in this meeting is actually just as much a director of this multi-million-pound company as I am. So I'm hoping that together we can try to concentrate on positivity and less on negativity. More time on getting behind our staff, each and every one of them, more for working for the best for our residents, and more relevant discussion between us. Because any successful business does have to have good communication. So I'm pleased to announce my deputy leader, Richard Dodd, and a cabinet, which I shall read out to you now. This has been refreshed in terms of responsibilities, and they are laid out in the agenda. But these better align to the key areas of work. Corporate services will be Councillor Nick Oliver. Adults Wellbeing will be Veronica Jones. Community services, John Riddle. Business and Tourism, Richard Wearmouth. Children and Young People, Guy Renner-Thompson. And Healthy Lives, Jeff Watson. You know the business chair and the deputy business chair, and I'm looking forward to working with them. And in the cabinet will be our equality and diversity champion, Wendy Patterson. Wendy will work with Councillor Jones and sit in cabinet meetings, specifically to renew our commitment to all people in the county protected in law, to protect them from discrimination and disadvantage, and to make sure that equality is at the heart of everything we do. Thank you.
Thank you, Leader. I do have hands up from Councillor Dale and Councillor Dungworth. Can I ask, I think Councillor Dungworth was first. Can I invite you to put your point?
Thank you, Chair, and congratulations, Chair, on your appointment. Congratulations to Councillor Sanderson as well on his appointment. We have not voted against this appointment because we acknowledge that it is the responsibility of the major group on this council to choose and appoint their leader and deputy leader. However, despite having a lot of personal respect for you, Glenn, and a belief that you can do this job, I have to say that you are on probation at the moment, as far as we're concerned, and your administration is as well. We are disappointed to look at the list of cabinet members to see there are still a number of people in that cabinet over whom there are some serious questions hanging. And we regret that you haven't taken the opportunity to genuinely have a clean start.
Councillor Dungworth, I've been quite generous. I've been quite generous allowing you to speak.
No, I'm assuming as well that the extra positions that have been created are at no additional cost to this council at the moment. Thank you very much.
I'll invite Councillor Sanderson to respond to that if he wishes to, but there is no actual provision for debate here, although I was quite generous there. So I'll go over to Councillor Sanderson.
No, you are correct. There will be no additional SRA involved.
That's right. Councillor Dale, in relation to what I've just said, would you like to express why you've put your hand up? And you're on mute at the moment, so you need to unmute yourself.
Been muted again. Right, sorry. Just to say thank you very much. I think everybody understands that this council, but not only this council, but all the residents of Northumberland are going through very, very difficult times at the moment. And as a council, we need to all work together over these very difficult times. We've got to bring everybody together. There are a lot of people working very hard. The staff are absolutely amazing about how they're going on with their work. And it's only appropriate that we all work together for the benefit of the people. I have said this very clearly to Councillor Sanderson, and I congratulate him on his appointment. And I would actually thank him also for including everybody in a meeting last week to discuss COVID-19. And I think that was a really good start. But there are one or two things that I have said to him that I will hold him to account. I can go through those letters and I might speak to him later about them again. However, there is one thing that we need to address, and I would ask the cabinet member for education. You will realise that the F40 has written a letter to the Department of Education about the delivery of education and school services, and it is a very, very thorough letter. And this council needs to get behind all these schools by supporting the F40. So could I ask, please, that we go straight away back, have a look at the F40 report. It's long, but it is necessary that we support the schools. So can I put that to Councillor Sanderson, that he will do that and make sure that this council supports the schools throughout this COVID-19 epidemic, please?
Again, I'm being very, very generous there. Go to Councillor Sanderson for response there, if he wishes.
Well, I would simply say that I take the points that have been made on board, and I will do the best I can to deliver some outcomes.
Right, I'm at this point. I can see Councillor Dickinson has got his hand up. Is this to do with a point of order, Councillor Dickinson?
It's not, but I just wondered if you were still being generous, Chair. It's always worth a try.
No, my generosity only stretches so far, Councillor Dickinson. So I will move on to the next part of the agenda, which is to note the appointment of deputy leader and cabinet members and their portfolios. Can we have that noted?
Chair, just to confirm, Gordon Webb is now.
Fantastic. Okay, is that confirmed? Are we noted that? Yes, excellent. Okay, I'm now going to move point 10 of the agenda up the agenda. The update on COVID, to receive an update from the Director of Public Health, and I invite Liz Morgan to address the meeting.
Thank you very much, Chair. I'm going to share something with you, hopefully. Okay, so can everybody see that?
Yeah, yes, I can see that.
Yeah. Okay, so what we've developed for you and for the public is a public-facing dashboard which provides you with the very latest information that we have available. And I'm going to use this just to talk through where we are in terms of coronavirus across the county, because the situation has changed significantly in the 3 weeks since I last talked to you. So if I had been talking to you 4 days ago, I would have said that in the fortnight up to the 19th of September, we had nearly 300 cases. And that's 10 times the number of cases that we had a month prior to that. But speaking to you today, we have nearly 300 cases in the last week. So this infection is spreading exponentially within our community. And if you look at the timeline on the right-hand side, that steep line on the right just gives you some idea as to the rate at which cases are increasing. And there is some analysis which suggests that actually the rate at which cases are increasing in Northumberland is one of the highest in England. What we've also produced for you here is a map which shows the number of positive cases over the last 7 days. And we've also identified the wards which have got cases greater than 5 in number. And I think at the last minute, at the last meeting, I pointed you in the direction of a public-facing website, mapping website, where you could put in your postcode and it would tell you the number of cases in the previous week. The data that we're providing for you here is much more up to date. The data on that public website is about 3 days out of date, but we've provided for you here the data that we have available. So if you look at the data for September the 22nd, it does identify 2 cases, but that just indicates the lag time. When you look at this public health overview dashboard tomorrow, that number will have increased significantly. So in terms of this infection then, we've really have got widespread community transmission, although the rates are still highest in the southeast of the county, in Ashington, Bedlington, Cramlington. We're now seeing that infection is spreading up the coast and along the A69 corridor, and we are seeing cases popping up in our most rural communities. And that obviously is a real concern for us. What we're also seeing is an increase in Pillar 1 tests. Now, the Pillar 1 tests are those that are done in hospitals, and that increase reflects both the increased prevalence of infection in the community, but also the increasing admissions that we're seeing for patients with COVID-19. And Northumbria Trust will tell you that they have some very, very unwell patients in their hospital with COVID-19 at the moment. And that reflects really what is happening nationally. And ultimately, increases in admissions leads to increases in deaths. We're seeing a significant impact in schools. So we've currently got 31 schools with positive cases. We've got 1 school which has got multiple year groups off because of children who are self-isolating in a bubble. I think the impact that is having on parents is significant. I think the impact is lesser because I think because of the lobbying done in the North East, an exemption was put in place for informal childcare last week, so at least parents can continue to use informal childcare to support children around accessing schools. We've made a bit of progress in terms of testing. So we now have one local testing site which is up and running in Ashington. We have another one which is being built in Blyth as we speak. We've worked with the community to address their concerns around lighting and noise, and hopefully the benefit of having accessible testing in their community will outweigh any inconvenience caused by having those local testing sites in their communities. I think we are at a critical time with this infection. We can get back control of this virus, but it has got to be a collective effort that we all commit to. And I think the problem is that if I, as an individual, take a risk, I think we are at a critical time with this infection. We can get back control of this virus, but it has got to be a collective effort that we all commit to. And I think the problem is that, if I, as an individual, take a risk, then that risk is actually translated to all the people that I have contact with. And some of those contacts will be the people that we're really trying to protect. So, and I'm talking really about older people, about those people who were shielded, who are clinically vulnerable, about people who are living in care homes. And, those are the people that we're most likely that we most want to protect, but are most likely to come to harm from transmission in our community. I think also there are things that we need to and must do as individuals. So, we've got to be careful about adopting those social distancing rules, about being consistent in our wearing of face coverings, hand washing. That will reduce our individual risk. We can also reduce the risk by complying with the legislation around household mixing, because we know that a lot of the increase that we're seeing is a result of mixing between households. But we also need to just be very careful about who we socialise with generally. And the recommendation is that actually we just reduce the people that we socialise with as much as possible and restrict that to our households outside the work environment. So I think we're at a bit of a tipping point. I think we've got an opportunity to get control back, but it does require all of us to be really conscientious about complying with the new restrictions which are in place and the accompanying guidance. I'm very happy to take any questions should anybody have any.
Okay, Chair, I can see 3 hands already, and that's Councillor Bridget, Councillor Seymour and Councillor Hill. So I'll take you in that order. And if anyone else can put their hand up, I will then invite them after those 3. So I will invite Councillor Bridget. Can you ask your question?
Yes, Liz, that dashboard that you put on the screen earlier with all that information, are you going to make that dashboard available to members of the council? Because that is very helpful information. And it's certainly better than what we're getting through the ARCA system, which is the link that was shared after the last full council, which is out of date the minute it's printed. so that dashboard that you've got there would be very helpful. And the other thing that you mentioned with regards to Northumbria Healthcare Trust saying that they've got some very poorly people in their hospitals. I've been told that admissions to the COVID ward at Cramlington has tripled in the last 2 days. Is there any truth to that statement? Thank you.
So in terms of the last statement, I don't have any details about the numbers of individuals, only that the numbers of individuals are increasing. Individuals being admitted with COVID-related symptoms are increasing. I don't have any numbers that I can translate for you. In terms of the dashboard, yes, this will be in the public domain. We're just finalising the IT fix to make that possible. I'm hoping that we will be able to send you a link to this later today.
So, okay, Councillor Bridget.
That's perfect. The quicker we can get the link to that dashboard, the better.
Okay, Councillor Seymour.
Yes, thank you. Actually, Councillor Bridget touched on that a bit. As you say, Liz, this county is now one of the highest in England at this time for cases. And with the increased projection, will there be enough hospital capacity if needed? I know that there's a Nightingale Hospital down in Blythe Valley, somewhere down there. Is there enough, do you think, with the projection? Have you looked at those numbers?
Well, I mean, clearly the NHS is doing a huge amount of planning based on what we're seeing across the country, let alone what we're seeing locally. But actually, given the level of infection that we're seeing at the moment and the impact that that's having on transmissions compared to the level of infection back in April and the impact that that was having on admissions, we're in a quite different place, because at the moment, the infection is still largely in younger populations, even though the average age is increasing. And what we want to do is make sure that that infection does not get into those communities which are most vulnerable.
Okay, can I move to Councillor Hill?
Thank you, Chair. Can I just ask you, and I appreciate this is maybe going out with slightly your remit, at least the first part of it, but what's your thoughts on the very obvious situation at the moment that the public are, in March, they were generally, the vast majority were supportive and adhered to the lockdown. But now there's a lot of frustration and a lot of people are saying, where is this going to end? You know, what about the economy? What about choosing life? Don't we mitigate risk all the time? Don't we just have to live with things like flu that kills tens of thousands of people each year? So I wondered if you had any sort of comment on that and about the sort of public fatigue and more the anger and frustration. And from a sort of more specifically health point of view, if you were to predict the future, are you going to say next year it's going to be the same, 5 years it's going to be the same, until there's a cure or vaccine, it's going to be constantly restrictions, constantly switching these things off and on, maybe occasionally going back to full lockdown? What is the future going to look like?
I don't have a crystal ball, unfortunately. I think in terms of, you know, comparing this to flu, this is much more virulent than flu. So, you know, the level of morbidity and mortality that we would see in vulnerable populations with this virus is much greater than we would see with flu. So I think that's the first point. I think, you know, clearly there is a balance to be struck. We can't live in permanent lockdown, and neither can we let the virus just run unchecked through our population. So we need to tread a middle path, which is always going to be a trade-off between trying to put in place restrictions to suppress the virus and keeping the economy open. And I guess that that is really what the government is trying to do. In terms of a vaccine, I think I'm not sure that anybody actually knows when a vaccine is likely to become available. There is a very robust clinical trials process that has to be gone through. And whilst we might have been able to, you might be prepared to cut some corners if you're looking at something like an Ebola vaccine, but for this, we're probably not going to be in a position to cut corners. So, normally the development of a vaccine, it is quite a lengthy process. I think the Chief Medical Officer was saying that he would expect a vaccine to be in place sometime next year. But even then, I think it depends on how effective the vaccine is as to the impact that it will have. So, in summary, I think there is still a huge amount of uncertainty with this virus in terms of how long we're going to have to live with it, and even if we get a vaccine, are we still going to see coronavirus within our population, but perhaps not at the level that we're seeing it at the moment. We're still in a situation, I think we'll continue to be in a situation with a lot of uncertainty for some time to come.
Okay, right. And my next trio are Councillor Robinson, Councillor Purvis and Councillor Daly. So I'll come to Councillor Robinson, please.
It's already been asked, Councillor Bridget asked, it's just the importance of being able to supply our residents with up-to-date factual information, because we really need to start winning some hearts and minds here. As Councillor Hill said, we've come through months and months of this. People are getting a bit shell-shocked by the news and sick of having to go through these things. We've got to keep reinforcing this message, and that's one way we can do it. And if we can have a public message about that dashboard, daily, weekly, whenever you do it, that's a great start. Thank you.
Yeah, sorry. I think the dashboard will be in the public domain, and certainly we can, put out a daily message in terms of what that dashboard is saying. I think the comms team have worked incredibly hard to get messages out in, multiple formats, and I think you're right. The public is actually quite fatigued, and there is still a lot of confusion out there in terms of what we're asking them to do, and that's something that we need to get very clear in our comm strategy.
Liz, can I just say one thing? I've been to work today and nobody knew about the regulations the North East has put in. Not one person. They were shocked. They were expecting the government to do it. I said, we've already done it. We've gone further. Nobody knew. So we need to be getting these messages out, mate. Thank you.
Okay, thank you, Councillor Robinson. Next one is Councillor Purvis.
Hi, Liz. Can I just say to Councillor Robinson, where does he work in the top of Cheviots? Because I think it's constantly on the news and constantly on the radio and everything. Anyway, Liz, the first year, I thank your team. You're doing a fantastic job, and it's coming back again. So I'm sure you'll manage it. What I'm interested in is the care homes and that. Obviously, the last time the care homes was badly let down by the government, not yourselves, in various different ways with PPE and tests and stuff like that. I'm just wondering what the state of play is in care homes in Northumberland, and do you think that they're more prepared this time if it does get a lot worse? Thank you.
So I think that's a really good question. In terms of PPE, we've worked really hard with care homes to make sure that they do have the PPE that they require, and we'll continue to make sure that that is the case. A lot of that we have funded ourselves because we realise that is a financial pressure on care homes, and we wanted to make sure that that was something that they didn't have to worry about. We do have, I think care homes are just much more prepared than they were earlier in the year. We have a specific wraparound support team for care homes. So that's a multidisciplinary team, which includes some of our adult social care contracting staff. One of my public health consultants is chaired by Annie Topping, who's the Director of Nursing in the CCG. And it's also supported 7 days a week by the Infection Prevention and Control team in the Trust. So we provide 7 day a week support for care homes. We have really good information about symptomatic cases and positive cases in care homes. And I think the most current data is, at the moment, we have 4 outbreaks in care homes, but 3 of those have been identified through the whole care home testing process. So they're largely residents or staff who have been asymptomatic. I do genuinely think that we are supporting and managing care homes as well as, if not better than, the majority of local authorities.
Thank you. Keep up the good work. Thank you.
Thank you.
Councillor Daly.
Thank you very much for the presentation, Liz. And I think it would be totally remiss of me not to acknowledge, and I'm sure I speak on behalf of everyone here, the tremendous amount of work which is being done by our staff across all sections in all departments during this continuing COVID situation. So I think we should put that on record. And obviously I know Glenn is on the call, and congratulations to you and to Richard. What you're doing is going to be a very, very challenging, but it's a really rewarding job. So, I'm sure we'll all do our best to give you every support we can during this difficult situation. And Glenn, you stepped up to the plate absolutely in terms of the call to government to change the rules around childcare. So I want to thank you for what you did on that. But that demonstrates something very clearly to me, is that particularly our schools need that additional support, and particularly around communication, because I think that's one of the big issues which we need to get right, is to ensure that where there are outbreaks in schools, that is communicated very quickly to elected members so that we're not on the back foot. So I think that's something I'd like to take away from today, is to look at how we get that channel of communication through to elected members. And in terms as well about how we can support schools, because that's the focus that I want to have, it's around ensuring that we lobby government for a recovery premium, because there is no doubt that many children, including children from very disadvantaged areas, will be disproportionately impacted from not having been in school for months. And our teachers or head teachers or support staff are doing an incredible job and have done an incredible job, but I think they need some of that support. And some of the things that we need to be thinking about is about repurposing some outdoor space, because we're coming into an autumn and a winter period. It's been fine so far when the weather's great, because young people can be outside, but as weather changes, those areas need to be protected from rain. They need to be repurposed. So I do think we need, as an authority, to be looking at how we can put in additional support for our schools. So I just really want to say that, there are a huge amount of things that are being done, and done very positively. We can always do more, but I think, as Councillor Dale mentioned earlier on, we need to be working together. We've got to really be seen by the public to be working together, and to ensure that all of the talents that every one of us possess is actually put into making sure that our county gets through this second wave as best we possibly can. And you will certainly have my support on that. And one quick appeal: I would love a testing site in Cramlington. So please, if I can put that on the table now, but we're here to support.
Okay, I'm not sure if there was a question there to Liz or at all, if Liz wants to come in on there.
Well, no, I don't think there were. I think it was a series of observations, but I do think we need to be looking at additional support for our schools. And I think about that communication from schools through the council to elected members so that we're not on the back foot if there are positive COVID cases.
Okay, well, thank you for that then. My next, and firstly, I'll just say thank you for councillors for your patience here. I am looking at your electronic hands going up. But the next trio I have is Councillor Dungworth, Councillor Campbell and Councillor Heppel. So can I ask Councillor Dungworth to ask her question?
Yeah, thank you. I've got a few questions, if you don't mind, Chair. Thank you for that presentation, Liz. Your presentation's always really helpful and really thorough. And like several other members before me, I want to thank you and your team and the rest of the local authority who I know are working flat out to try and keep on top of this. I also want to applaud the position taken by the LA7 authorities. It was absolutely right to take that proactive approach. And I think right of our leader to be part of that team, although it was quite difficult. He was only an interim leader at the time. So well done on that. I'm noticing in our figures as well as in the national figures that this time we seem to be seeing a rise in younger women contracting this disease between 20 and 40. And obviously some of the reasons for that are around social life, but they're also around the sorts of occupations that they're in possibly, and have young children. And, you know, there's multitude of reasons. And I think this question and the one connected with it are a little bit, you probably can't answer me, but I suspect we don't have such detailed data for the first outbreak or the beginning of this outbreak, because it's the same outbreak, isn't it? It's just up and down. So at that time, what we were saying, it was men and older men who were at risk, but that was at risk of dying. And so I suppose I'm saying we're not yet at the point where we can make any conclusions about the women who are being seen to have a rise in infection as to whether that's going to lead to deaths. So it's a bit of an in the air question, I suppose. I also welcome the increase, obviously, and I said this at the previous meeting, in testing sites in some of our communities who are most challenged in terms of accessing testing without a car. But we talked at the last meeting about whether the capacity of the labs behind the testing stations was up to scratch. And I just wondered if we had any indication as to how that's working. And I absolutely back Councillor Daly asking for a centre in Cramlington. I think I've raised that previously as well. I am interested to know if we locally with the LA7, LA12 or independently would be considering any further restrictions at any time. Because I am still deeply concerned that the people are not getting this time. They're just not seeing the big picture. And whilst, you know, pubs close early and people can't mix in with families and things, there's still an awful lot of community activity going out there. Our community venues are open, activity classes are going on in them. I'm already getting complaints from residents about increased number of visitors to the area, and I'm not in the most touristy area, although we do have it. So it's something about this that I can't see that community transmission stopping unless some of those community activities stop alongside. And I suppose my final question is, we have taken a cautious approach in Northumberland, and I think a lot of us here are very grateful for the experience that a lot of residents in Northumberland had in the first phase of this disease, because we were quite proactive and quite cautious. I am aware we do not have our chief executive at the moment, and I'm wanting reassurance that we have the same level of caution that we had from when we were led by somebody with a huge experience in this field. Thank you.
Liz?
Okay, so I'll start with your question about who is affected in terms of, you know, ill health. And I think although the people who are getting the infection at the moment are, you know, quite different from the people who were getting the infection earlier in the year, you're quite right. We are seeing higher infection rates in younger age groups. But I think in terms of people who are going to come to harm from the infection, that's probably not going to change. That, you know, that's still going to be those people with long-term conditions, people who are in older age groups, and those who fall into that clinically vulnerable category. I don't think that is going to change because we're seeing higher infection rates in younger people at the moment. In terms of the capacity of labs, I think what we've realised is that it seems that the areas that shout loudest get the capacity, and despite the fact that the North East has, you know, voluntarily went into or adopted some local restrictions, where we still feel as though some of that testing capacity is being diverted nationally to the North West and West Yorkshire. And I think because we were, I think, quite successful at influencing the Secretary of State over the issue about informal childcare, we want to be as vocal about reprioritising testing capacity to the North East, because that, you know, from our perspective, that lack of testing capacity is undermining our ability. Well, it's undermining the ability of all local authorities to implement their control plans. So we will be looking at how we can lobby the government to make sure that that testing capacity is reprioritised to the North East. In terms of further restrictions, we have had a conversation as a group of 7 local authority chief executives and directors of public health about what our escalation or de-escalation criteria might be, and we're just trying to think about what that might look like. But I think in view of the fact that, you know, nationally we are getting into the realms of adopting further restrictions, I think if we put any further restrictions in place as a group of 7 local authorities, we might actually be overtaken by what's happening nationally. I think we probably need to wait a couple of weeks to see whether the restrictions that have put in place are going to make a difference. And just see how we get on. And I think in terms of, you know, the approach of the local authority and, you know, the approach that we've been taking, which, as you say, has been quite cautious. I don't see any reason why we shouldn't continue to take that cautious approach.
Can I just check, Liz, when you're talking about vulnerable people, and, you know, we accept that's where this ends up, are there any plans for bringing in shielding, either locally or nationally, or offering support for people who we really would prefer to encourage to stay at home? And yet we absolutely need to use the political might in the North East to get some extra resources here. And let's make sure that our MPs are shouting loudly from the rooftops on this matter as well.
So I think in terms of shielding, there's only one area in the country which has advised that group of individuals who were clinically vulnerable to continue to shield. But we do need to get the message out there that all people who are vulnerable, whether they fall into that clinically vulnerable group or not, should be really cautious about what they do and who they socialise with. And if anybody needs to comply with the legislation and the guidance, it is that group of individuals, because they are absolutely the group that we need to protect.
Okay, can I just come in here? We've got a little bit of a technical issue, so I'm just going to ask that we adjourn the recording of this meeting just for a second, for 5 minutes, I'm being told, just so we can sort a technical issue. I do apologise. He has confirmed that, I'm told. Okay, so I'm going to go to Councillor Campbell for her question.
Thank you, Barry. It's just to say thank you to Liz for her presentation. And I would just like to say, you know, we've got to get behind the hospital staff, the doctors, nurses, and our staff. It will be a difficult time in the next few months. We can play our part by adhering to the rules as best that we possibly can. I would like to say also that it's welcome that we have a testing site in Blythe and one in Ashington, which, you know, we don't have many good things happening in Blythe, but I think people in their circumstances will look upon the testing site as being something which is beneficial to everybody. I'm quite sure there are parts of the country which would love to have 2 testing sites in close proximity. So just to wish everybody well and work alongside the rules, and we do, maybe we'll come out of this better at the end of it, hopefully. Thank you.
Thank you, Councillor Campbell. Councillor Heppel.
Yeah, thanks, Chair. I just want to echo and add my voice to the request to have a testing facility in Cramling. And as you can see from the figures, the numbers in Cramling and Village, I saw Village, I think, as being a particular problem. In relation to the information going out to the public, I think one of the problems is there's a bit of a confusion. Some of the confusing questions I'm getting or from my constituents is the difference between the local and the national lockdown, and which one to follow all of them. I'm not sure about that one. Maybe Liz could help on that one. But I think officers in this authority, in many ways, have led the way in their response to COVID. One example being, I think, with the help of the former, the chief executive, who's on extended leave, slip of the tongue there, sorry. She was quite active in this in terms of her experience, both in local government and in the health service as well. And that was quite a useful combination. But she did actually not allow patients being discharged from hospital who had COVID symptoms into care homes. I just wondered if that kind of cautious approach was going to continue. And the final point, I think, is that in terms of the information, the confusion out there, people not getting the messages, some councillors have made the point there, is that in terms of getting the messages out, I think we need to be a bit more hard-hitting with this one and a bit more. I mean, statistics are fine. I've lived with them all my life, but not a lot of people can understand them. So I think some kind of hard-hitting bullet points, and perhaps as well, people with some stories from people who've actually had COVID and experienced it, actually getting those kind of messages out to the public as well. They tend to be more hard-hitting. I don't know if that's something we've thought about. But again, Liz, thanks for all the work you and others have done in relation to this situation. Thank you very much.
Hey, Liz, do you want to come on that?
Yeah, so in response to the confusion within the public, frankly, I'm not surprised that the public is confused. Clearly we have 2 sets of restrictions. We have the set of restrictions which have been put in place by and on behalf of the North East. Some of those now overlap with the national restrictions. I think the advice will be to adopt the restrictions which are the most restrictive. That's probably the safest way to approach them. But I absolutely understand that people are confused, and we need to make sure that the messages that we put out are as clear as possible in terms of what our expectations are of the public. Because I think, as I've said before, the only thing which is standing between us and a much more restrictive imposition is the way that we behave over the next few weeks and months. In terms of discharges into care homes, we work really closely with Northumbria Trust and the CCG, and I know that there are conversations ongoing to make sure that we do support care homes as much as possible, and that we endeavour not to discharge individuals who are COVID positive into care homes if that's at all possible.
Okay, thank you, Liz. I've got a few questions left. I would welcome members to be brief if possible with their questions, because I want to get everyone in. So I'm going to ask my next trio of Councillor Dickinson, Councillor Swinburne and Councillor Dale. So I can ask Councillor Dickinson to ask his question.
Thank you, Chair. I won't take offence. I'll get in this time. Liz, thank you very much for all the work that everybody's doing. I do echo the points made around the initial approach to wave one, as it were, in Northumberland. I think the council took a very pragmatic approach in terms of services, protecting the workforce, protecting communities, setting up the community hub, all really good work. I also echo the comments made by Councillor Heppel around Daljit Lally and Stephen Holmes providing fantastic leadership around our care homes and giving that real confidence to the public and residents and families who have people in care homes. I am concerned that the communications, although Anne Bridges and her team have done a fantastic job up till now trying to differentiate between local and national lockdown, we are persistently telling people what they can't do. And I think that always provides some kind of negative reaction. I'd really much prefer some of the detailed facts that Liz has provided today. And we've had this debate on email between members about what's confidential and what's not, because actually some of those figures show Northumberland to be increasing rates far higher than other places in the country. It was reported in The Guardian, but we haven't reported it locally. We haven't done any work locally on those kind of facts on the council social media. I think people react very differently when they can see the facts. And I think we need to encourage people to play their bit, do their part to protect other people, but we need to provide facts. People won't just do as they're asked to do without being given the facts, and that would be my only plea. But thank you very much, Liz, and thank you to the officers for restoring some confidence in what is a council that's got some confidence issues at the moment. So thank you very much.
Okay, does Liz want to come in there?
Just to say that the dashboard, which I showed you earlier, is on the council website, and we will make sure that all elected members are sent a link to that.
Brilliant. Oh, and Liz, I forgot to ask, sorry, Chair, that are the information briefings that were labelled confidential still coming as confidential, or can we share some of that information with our residents? Sorry, Chair, I forgot to ask that.
Okay.
It's probably, I can't remember what's in there, to be honest, but it's probably safer to share the website, the public dashboard that's on the website.
Okay, thank you. I'll go to Councillor Swinburne.
Thank you, Chair, and thank you, Liz, for this information. As ever, it is very insightful, the information that you pass on to us. It comes down to, as many people have already have mentioned, the level of communication. For example, the initial information that was passed on about Northumberland having very low rates was correct, but the level of increasing cases, residents weren't exactly understanding how that was expanding on those level of cases. But when they were shown the two maps that we received on the initial case numbers and then how it was expanding, people started to suddenly realise, and it started to hit home, how these numbers were starting to expand and increase across Northumberland. And the penny started to drop with a number of people. So the information that we've seen again today to see that expand even further and those numbers increase more, and as you said, it's on the website, goes further to reimburse that. What isn't helpful, and I received a number of queries about this yesterday across Cramlington, and obviously it's disappointing to see that my own ward, Cramlington Village, is third highest on the list there. But what isn't helpful is you're probably aware of a huge illuminated red trailer which has gone around not only Cramlington but a lot of southeast Northumberland, which states coronavirus, this is a high risk area. This has set panic among residents. It's very distracting when they're driving around. It's parking up in various areas. It's been seen in Cramlington, New Biggin, a lot of southeast Northumberland. I understand it's been seen in Whitley Bay today. It's not being done locally by our council, I understand, nor the CCG or local NHS. And I know we've got to get the message out there and people have got to understand, and we're working hard with our comms team to do that. The result of seeing this massive trailer driving around is panicking people. And what is happening now is we're seeing panic buying in the shops, as we were seeing earlier on this year. And we need to get the message across to residents that please don't do the panic buying yet again. It's not necessary. And I don't know whether we can get anything in with comms to get along those lines as well to stop the panic buying, because we'll end up back in a situation where we were a few months ago, where stuff will start getting restricted down to 2 or 3 items. But I don't know whether anyone such as yourself was aware of this big trail going around, whether there was any communication given to yourself or anyone else at the council on that. But it comes down to the comms again, getting the right people and the right message out there. And I don't know, I'll ask the question, do you think this big trailer is the right thing to be getting around? We've got to get the message out there, but is that really the right thing that we should be doing? Or that, I'm not saying that should be done.
I don't know is the answer, but actually, if it's provoking panic, then we probably need to think of some other mechanism to get that message across. But I'll obviously be having a long conversation with the comms team, because you've collectively come up with some really good ideas around comms and our future approach. So I will bring that into the conversation, if that's okay.
Great, thank you.
Okay, I've got Councillor Dale. You're on mute, Councillor Dale.
Is that all right now?
Yes,
Right.
thank you.
Thank you very much. Just to go back on what Councillor Daly said, if you could look at the F40 letter that's been sent to the Department of Education, it will actually show all the needs that the schools have, and they're quite substantial. And I know certainly in the area is small schools are finding it very difficult to manage because of just the testing takes time to come back, etc. So just if you can keep that in mind. The second one is about the testing sites. Northumberland's enormous, as you know, but it goes all the way up to the borders of Scotland, but it also goes across to Cumbria, and it also goes down to Durham. And I know I've had problems with people who've had to get tested. They've actually been told to go to Edinburgh when they found they could have gone south, actually somewhere else. So when you're actually considering the whole area of the testing area, I presume that we don't have to stay in the Northumberland area to get tested if we live 2 minutes down the road from, say, Durham, or 2 minutes up the road to Edinburgh or whatever. But if that could be made people aware of that. The other thing about this comms is always difficult, because certainly in our area, a lot of older people in the rural area as well. Not a lot of them get newspapers. Some of them haven't got super fast broadband. Some of them aren't on the internet, etc., etc. And actually, when it comes down to people working with people, it's generally their local councillor who actually knows them and has ways of getting the information out. And if you used each different councillor, certainly in the rural areas, I think that would be beneficial to everybody. Certainly we have a very clear way of getting things out, messages out to everybody, and everybody works consistently together. You will have within your community hub contact list those people who are looking at and developing, who are working as volunteers in certain areas, and the county councillors will know those people as well, or be working with them. And I think that's a really good way of getting out, especially if there's a high risk, if one area in particular is becoming high risk. I do know that yesterday the wagon was going around with the NHS sign on saying alert your risk around Predo, and that people came to me about that. But I gather it obviously from everybody, it was everywhere else. But just to say thank you once again. But the comms thing's always difficult, because people just don't have the type of comms which we think everybody has. People aren't on Facebook, people aren't on the internet, people don't get on every day, and they only use a newspaper once a week. So it is quite difficult. So they do watch the television, but that's not local.
Hey, Liz, do you want to come on that?
Well, I can probably answer some of the questions about testing and availability. So the availability of testing is really set nationally.
Yeah.
my understanding is that testing slots are released at about 10 o'clock in the morning for the afternoon, and between 6 and 7 o'clock in the evening for the following morning. And they will automatically direct you to whichever is the nearest testing site. And that will also take into consideration whether a mobile testing unit is scheduled to be in that particular area in the sort of following 24 hours or so. But I think what's been happening, and it sort of goes back to the issue about testing capacity, is that because the testing capacity is being diverted elsewhere, the number of testing slots that are available for locally for people in the northeast is clearly inadequate.
Yeah, absolutely.
Right, I'm going to come to my final, and it's going to be 4 rather than 3, and then we'll draw this to a close. I'm going to ask Councillor Grimshaw, Councillor Foster, Councillor Quinn and Councillor Castle, and I'll draw this to a close. So Councillor Grimshaw.
Thank you, Chair. Well, actually, there's a lot of the questions that I was going to ask been answered. Once again, Liz, thank you and your team because you're doing a fantastic job, and hats off to you. We're really appreciated. I'm sure throughout the community, as well as Councillor Daly touched on the schools, as well as Councillor Dale and Councillor Dungworth. That has been a major issue. Not only that, I know some of the schools is now having to take out of their budget to provide children who are having to, go to home to learn and having to purchase laptops or tablets out of their budgets, which are stretched to capacity anyway. So I just wondered, if we could, maybe Councillor Sanderson could lobby the government to see if we could get some more resources into the fact that, schools are stretched and out of their budget, having to provide these tools for the children to be able to homeschool is vital. And the other thing is, Liz, if you don't mind, I just wondered if you could, perhaps not today, give an update about the community hub and how that's still going and how we could move forward with the volunteers, because especially looking at the figures in Northumberland and especially around the southeast is really, frightening. And I think that perhaps, we could kind of look at that again to see how we can all help and assist with that, getting that up and running again and contact people who are vulnerable and isolating, etc. Because I think a phone call means a lot to some of these people, like they did before, and we're contacting people. It's a lifeline. So I think if we could get some information of how we can move forward as far as the community hubs and volunteers are concerned, I'll be very grateful, Liz. But thank you once again to you and your team. You're doing an absolutely fantastic job. Thank you.
Thank you. The community hub has obviously continued to operate during the whole of this period, even during the period when our rates weren't as high as they are now. I think we are very conscious that there are people who are going to be required to self-isolate who will find that a real challenge from both a financial, practical and social point of view. We just want to put the message out there that the community hub is there to support those individuals as well, not just all of those individuals who were previously required to self-isolate because they were vulnerable. But we will make sure that an update on the community hub is provided to elected members.
Councillor Foster.
Thank you, Chair. Again, I'd like to echo the sentiments said by many of my colleagues here to thank you, Liz, your team, and anyone else that's been involved in the work that you are all doing. And again, thank you for that dashboard. I think that's very, very informative. It's going to be really, really useful. My concern, again, is being raised by a lot of people, communications and getting the message out there. It's just flashed up on my phone, highest daily rate since May the 1st today, 6,178 new cases. But the apathy I'm seeing on social media is unreal. There are a lot of people who understand the restrictions, support the restrictions, and who are going to abide by the restrictions. But the amount of people who are going the other way is quite frightening, frankly, when we've actually got this increase already. And that sort of behaviour, you worry that is going to contribute to higher numbers again. And just one thing came up over the last few days. We had a restaurant advertising it's okay to come with other households. Maximum is 6 people, but it's okay to mix households. But that's after we've had the message going out there that you can't have mixed households in a private home and garden. And most restaurants and pubs are working to the spirit of those regulations and not accepting groups from mixed households. But then you get some where they're saying, we've spoken to county have said it's fine, the regulations allow it. And when you have a look at the gov.uk website, it basically has the wording, we advise that you should not. So their wording is advise, and obviously for the mixing of households in private homes is you must not. And it's sending such mixed messages out to the public. It's confusing for the public. The public feel they don't know exactly what the regulations are because one person's interpreting them one way, another person's interpreting them another way. And I just think we really need to be on top of the communications aspect, get the real message out there and get the message out. Yeah, maybe it is advised, but if you really want to combat this awful virus, you want to get the figures down, then we need to work in the spirit of these tighter regulations. Thank you, Chair.
Hey, Liz.
Yeah, I mean, I completely agree with you. You know, it's unfortunate that we've got that we've had to put in a distinction between the legislation, which is clearly what people have to do, and guidance, which is what we're asking people that, that they should do. And although in the, the North, when you read the Northeast restrictions information, which is on the government website, it does talk about the expectations in terms of businesses making sure that people who are using their, particularly hospitality businesses, are from the same household. I think, the way that is being put in practice is quite variable. And I know that we have seen, quite a bit on social media from some hospitality venues that, when you read it, it looks as though it's encouraging you to not to follow that guidance. So, yeah, I mean, I think we need to be quite blunt going forward in the way that we communicate to the public and just make it clear that, while it is guidance for everybody's benefit, we need people to follow that guidance as though it was the law.
Okay. Councillor Quinn.
Yes, hello, thank you. Comms again, I'm afraid. Like everybody else, I had a number of emails when we first announced the Northeast restrictions saying this is absolutely ridiculous. We don't have a problem in Northumberland. It's all the fault of everybody else. So I agree with Councillor Dickinson that it's important that we do get the figures out there and we do make it clear to people that the figures are rising quickly. Equally, I've had contact from some of the older people in my ward who did isolate during the first period. I've had people in tears and they are terrified and they are so upset at the thought that it was one thing in spring when it was sunny and when the nights were bright, but this is going to be winter, the nights are drawing in. They are really scared, they are very frightened, and it's that balancing act that has to be kept between making people very clear that we are up against something serious, but equally not frightening people to death, which is the thing that I am worried about in some areas. And another just short thing, it's my eyes probably, but I couldn't read the dashboard before because the print was very small. Is there a ward by ward breakdown there? Because people are starting to talk in my villages, oh, they've got it, they've got it, and some accurate data.
Councillor Quinn, you're breaking up, so I think we've got...
What is actually happening would be very helpful.
Thank you. Liz.
So I think, the comms message is coming through very clearly, in that we need to, I think we understand the challenges. It is really tricky to get the messages across that we want to get across, in a way which resonates with different communities, different age groups, and and clearly we need to work harder to get that message across. I completely understand that those individuals who who fall into that more vulnerable group are anxious and worried at the moment, and I think our advice to them would be to just to take extra care. Nobody wants those people to nobody wants that vulnerable group to go back to a place where they're having to self-isolate at home. That is going to be really bad for their mental health and well-being, and that's just not sustainable in the long term. But I think as things stand at the moment, all we're asking is for those individuals to be extra careful about who they socialize with, and just to adopt all those measures around social distancing, the use of face coverings, and hand washing, etc., etc.
Councillor Castle.
Thank you. Last question, I think, isn't it, Chair? And thank you, Liz, for your very professional. You must be wilting under the barrage of questions, but you've done very well so far. And this is a genuine question, which I'm asking on behalf of the people that ask me, and I can't give the answer. As I represent Alnwick Ward, which, as you know, has got a relatively light rate of infection, and yet the visitor numbers to this part of Northumberland were in the tens of thousands. And I'm asked, is there an evidential link between the actual rate of infection and the number of visitors that we've had? Because there's been a presumption of that kind, that more and more visitors have actually led to the risk and increased the risk, and yet the evidence doesn't suggest that. They're mostly left now, and the question that I've got is, sorry about kill that. The question I ask is there an evidential link, please, between the actual rate of infection and the huge increase of visitor numbers in the parts that presently don't show any result from that? Thank you.
So I think from our analysis of the data, we might have expected an increase in the number of cases because of tourism, but actually, looking at the individual cases that we've got, we don't really have any evidence that those cases are related to tourism. Most of them are related to household mixing and household transmission. And just socializing in younger age groups. I mean, I think we anticipated, or we probably should have anticipated, that the release of lockdown, or after the release of lockdown, it was always going to be younger people who went to pubs and restaurants more and socialized more. They generally have more social contacts than older people like myself. So it's probably no surprise actually that it's those younger age groups that are in which we've seen large case rates. But going back to your original question, we really haven't seen any evidence that any of our cases, or the increase in cases, is related to tourism.
Thank you.
Okay, as Councillor Castle alluded to, we've had a long session on this. I'm going to be super generous and allow Councillor Gallagher to ask a very brief question, and then we're going to move progress.
Thank you very much, Chair. Well done to you and your team and everybody involved with these issues. But very, very quickly, the biggest thing that we've been talking about, or the biggest hurdle, is around communications. And I was just wondering, how do we link up? How does Northumberland County Council link up with the supermarkets? Because everybody now has increased their home delivery, and the vulnerable are even more, getting more home deliveries delivered to the house. Is there a way that we work with Asda, Tesco, Morrison's, all the supermarkets that deliver and use the Northumberland hub to a leaflet within that shop and have an update of what we're about around COVID-19, and to reassure and get the message out that way? Because it's been touched on before that a lot of people can't get onto the internet. A lot of people aren't connected through that age. We can't keep posting the messages out. to the rural places. And the other port of call could be petrol stations. You know, that if we had a signage there with a weekly update of the things that Northumberland County Council are doing, it gets a message out to everybody. Thank you, and thank you very much, Chair, for letting me in.
Liz?
Yes, I'm just writing all those down.
I beg your pardon.
They're very good ideas. I mean, I think we have had conversations about, you know, whether we can use community pharmacies, for instance, to push out messages. I think half the challenge is that actually this situation is changing so quickly that they would have to be quite generic messages, because otherwise the information that we would be pushing out would be, you know, out of date almost as soon as we'd sent it out. And certainly that's the feedback that I've had from other areas that have done leaflet drops, is that, you know, by the time the leaflet is written and has gone out, the information, particularly if it involves specific numbers, is quite out of date. But I think supermarket deliveries and petrol stations, I think they do provide a really good opportunity to get messages out there. So we can have a think about how we might utilise those as an asset.
Thank you, Liz. I'm going to draw that to a close, and I say thank you, every member, for your patience in that, and for putting electronic hands, and I'm sure Liz can answer questions, and this is not going to go away anytime soon, certainly. So Liz, I'm sure will be back in due course. And thank you, Liz, for your presentation.
Thank you very much.
I'll go to the next point on the agenda, which is point 6, announcements. I just have 2 very quick announcements to make. Sadly, to report the recent death of former County Councillor Wyndham Rogers Coltman, who was the member for Berwick North between 1985 and 1993, and also to report the deaths during lockdown of 2 former mayors of Berwick, Councillor Ivor Dixon and Alderman David Lockie. So I would just pass our best wishes on to friends and family from the County Council in respect of that. Thank you very much, Council. Next, I've got correspondence. I don't have any correspondence to deliver to the Council, so I'll move on to questions. Question 1 from Councillor Kennedy to, I've got the acting leader here, but to the leader.
Thank you, Chairman, and congratulations on your new post, and congratulations to you, Councillor Sanderson, on becoming the new leader of the Council. Okay, so the question is, the previous leader of the Council, replying to my question of the 2nd of September on the unnecessary close down of democracy during the pandemic at Northumberland County Council, stated that 84 meetings had been cancelled from a total of 136 between dates in March and August of this year. I'm conscious that there are a number of cancelled meetings in September also, including area committees for Tynedale, Ashington and Blythe, Castle Morpeth, Cramlington, Bedlington and Seaton Valley. Backbench councillors and residents feel excluded from this council and have felt frustrated that a dialogue has not been available to them on matters such as managing the impact of the lockdown and the reopening of our towns, high streets, schools, sporting clubs, etc. Can the leader provide assurances that one of his priorities will be to re-establish democracy into the council, so councillors and officers can start a dialogue with residents on these important matters via their local area committees, including electronic means?
Yes, thank you very much, Councillor Kennedy, for your question, and thank you for your kind words there. One of my priorities and that of the administration is to ease back into a full committee programme. I think September's due to have around 20 meetings. October is currently planned to have more, probably in excess of that. But I know that there is a meeting next Tuesday with the local area chairs, and the intention is very much to get back into the pattern of having regular meetings. I would like to see that, you'd like to see that, and I think we'd all would. So what I would add, though, it is COVID dependent. Obviously, we don't know what things are going to be like, but it's certainly the intention is there, yes.
Thank you, Glenn. That is welcome news. I mean, I would offer that actually, even though we have COVID, I think that is even a stronger argument to say have these local area council meetings and other council meetings, just so we can engage, we can converse, and we can get the residents, seeing what's going on and to actually ask questions. We've had an interesting presentation there from Liz, but let's face it, there is just huge conflicting messages coming from local and national government about what can be done and what can't be done. We look at those numbers of rising infections in September, yet in August we were all offered £5 off our fish and chips to go to the pub and all this type of stuff. So it is just an incredible confusing message for our residents to say, go to the pub, go and have a meal, and then as it's been mentioned, that there's signs being driven around saying, look out, you may catch the disease. So I do think it's really important that we can do this in a socially distanced way, via these electronic meetings, which have been really good. So I do urge that, we can use these local area committees as the vehicle to inform our residents.
Councillor Sanderson?
Yeah, I agree. That's fine.
Okay.
Thank you, Glenn.
Excellent. Before I move to the next question, Councillor Dungworth, did you have a point of order or likewise to add? You're on silent.
Sorry, it was under your announcements. I'm really sorry, and it's probably remiss of me. I should have told you, but we've also recently had the death of ex-councillor Olga Potts, who was a Blythe Valley councillor for a lot of years.
Yes.
And was still a parish councillor, a town councillor in Blythe at the time of her death. So I would like that recorded as well, please.
Absolutely, Susan, and I'm sure the council pass their best wishes. I've known John on the politics circuit for a while, and to the rest of the family and friends there, we will pass our best wishes to them.
Thank you.
Okay. Next question from Councillor Wallace to the Cabinet Member for Corporate Resources.
Thank you, Chair, and can I add my congratulations to yourself and Councillor Sanderson on your new appointment. I note that Newbiggin Sports Centre has recently had 1.5 million of capital programme funding confirmed. This is great news. Could the Cabinet Member therefore confirm that capital programme resources will be made available for Bedlington to support the development of weather facilities in the town centre?
Thank you. Thank you, Councillor Wallace. Yes, you will recall that in February, full council voted to include £500,000 in the capital programme to develop feasibility options for leisure facilities in Bedlington. And this was entirely separate from the multi-million pound Bedlington town centre regeneration plans. Almost immediately after that meeting in February, COVID struck, and that has caused significant problems in the retail sector right across the country, and necessitates a rethink of the Bedlington Town Centre regeneration scheme. Given that situation, the council has engaged Advanced Northumberland to develop revised proposals for the regeneration of the town centre, and including a focus on leisure, as I'm sure you're aware. This has been helped by a bid into the Getting Building Fund with £3 million now identified by the North East Local Enterprise Partnership to support the project, subject to confirmation of the final business case. And once the plans are finalised, the project will need to come back to council for formal sign-off. So I think there's a very exciting future for Bedlington. I think the town centre will at long last get the development it needs.
Supplementary, Councillor Wallace.
Thank you, Chair. I do. A recent press release from Advanced Northumberland on the exciting plans for weather facilities was very quickly downplayed by an unnamed county council spokesperson. This caused considerable consternation and unrest in the town. Could I have a commitment, please, that everyone at the County Council is fully behind ensuring Bedlington gets the Western facilities that it deserves? Could I also suggest that future press releases from County Council should be clear as to who the spokesperson actually is?
Yeah, well, to take the final point first, I'll sort of pick up that point around the spokesperson. Sometimes, things are responded to in a hurry, and but I generally, as a sort of matter of principle, I think agree with your point that generally it should be a named person. That's not always possible. So I will pick up that point with Anne, the head of comms. In terms of sort of wider commitment to Bedlington, I think it's true that over recent decades, Bedlington has been one of the forgotten towns in Northumberland, or worse still, it's been an ignored town. I think this administration has a commitment to Bedlington. Council officers, local councillors, the cabinet, and Advance Northumberland will all be working really hard to develop some exciting plans for Bedlington, and we'll keep you posted. We'll keep you involved at every stage.
Thank you.
Okay, I've got two hands up. Are these points of orders from Councillor Dale, Councillor Dungworth?
Yes, they are.
I'll go to Councillor Dale. You're on silent again.
Sorry, I had my hand up just to report the sad death of Councillor Audrey Hutchinson.
Oh, I'm sorry. Yeah.
I did mention that because she was long-standing councillor in Tyndale and leader of the Tyndale Council. But sorry, I had my hand up while you were going through that earlier on.
Yeah, no problem. We will note that and again send on our condolences and best wishes to the family. Councillor Dungworth.
Thank you. Yeah, it's a bit of a problem getting in when you've got to raise your hand.
Yeah, I appreciate the
sorry about that. Mine is a point of order. I want to know if that reply to Councillor Wallace was a political reply or an officer prepared reply, please.
I don't know if that is necessarily something we need to answer at this stage, is it?
It's certainly not.
It's not. I'm advised that's not a point of order, Councillor Dunn.
Okay, then I'll put it in as a freedom of information request. Thank you.
Okay, right. We move on to the next question, which is question 3 from Councillor Hill to the leader.
Thank you. In light of the recent shockingly poor governance within this council, including the failures to give any explanation as to who refused requests for extraordinary meetings of the council and the audit committee, and on what constitutional basis, and regarding the failure to provide any answers to questions around the process of the apparent independent investigation or assurances around its integrity. Do you agree that this is totally unacceptable, and how will you rectify the situation?
Mr. Chairman, this councillor knows that I arranged meetings for herself, with me and with the acting chief executive to discuss some of the queries that she had. But I want to move on to the word governance. What do we mean by governance? To me, and looking at the dictionary, governance can mean two things. First of all, around strong decision-making and service delivery. Let's just look at what's happened in the county over the last 10 days since the COVID decision was taken to work with the LA7. I can tell you this, that all the leaders and all the county's MPs, for whatever political persuasion they are, have worked absolutely closely together to get the right thing for the right county and the right thing for the county's people. I need to also say that despite all the difficulties, our staff have managed to get on and deliver 2 testing stations and all that involves. We've been brilliant, I think, in the internal and external communications. The hub we know about, the regular member briefings, which I've been keen to ensure happens on a very regular basis along with Kelly. We had an all-member workshop last week in which every single member was given as much time as they wanted to ask any question at all about how we were dealing with the COVID problem. And yet all of this, despite all of that, our services continued to be delivered across the county. So I want to say thank you to Kelly and to all the staff involved in that. Second definition of governance is around effective delivery of projects. Let me remind this councillor about what's actually going on in and around the place she lives. A new leisure centre, a new Maltings Theatre and Centre, improvements to Berwick Port, a multi-million-pound scheme for Berwick Old Bridge, a multi-million-pound HLF-funded refurbishment to a 200-year-old Union Chain Bridge, the largest cross-border, cross-council project of its kind, I'm told, ever. Improvements to Berwick's roads as part of this year's roads programme, which is one of the largest this council has seen for years. And across the county, huge improvements to our schools, a new school building programme, our work with older and vulnerable people, leading the field in our climate change work, investing across the county. So despite everything that COVID has thrown in our way, governance has shown us that we have had strong decision-making, effective project delivery, fantastic staff at every level who don't want to hear continued negativity, who want to start hearing positivity. So thank you to them. Thank you for their patience. Thank you for their hard work.
Supplementary, Councillor Hill.
Well, you answered a number of questions, but none of the ones that I actually asked. And do you not see that skating around the questions, saying, trust me, we're having meetings, mentioning staff, just will not do? You mentioned governance, something that you didn't mention, because I think you probably would have found that even that was a bit cheeky, even from you, to use the word transparency. There's absolutely no transparency. And my supplementary question is, and getting back to what I specifically asked, the fact of the matter is that myself and others have had absolutely no answers to questions we've asked or assurances around process. And do you not see that in a situation where you're not getting any answers to questions around process, where there's no transparency, that people within this council and the public will be suspicious of cover-ups and stitch-ups?
Right. So I think you've been very generous again, Mr. Chairman, in allowing a statement and then a long question supplementary. But I'm quite happy to debate with this member, till 8 o'clock tonight, or even all night, or even tomorrow as well. The point is that I arranged two meetings. Sorry.
Carry on, Chair. We won't have that debate to 8 o'clock, but carry on, Chair.
Yeah, so I arranged two meetings with the Acting Chief Executive and myself to meet this member and others. They had the opportunity to place those questions. They received answers. I allowed a follow-up meeting for that. If they still feel they haven't had the answers that they want, I'm more than happy for them to write to me again. But I will not have any negativity on my watch. I want to see positivity, openness, and getting on, thinking about our staff and thinking about our residents. Thank you.
Thank you, Leader. I'll go to question 4, which is from Councillor Hill to the Leader again.
Thank you. I will be positive and not negative when there's reasons to be positive, but when there's reasons to be very negative and depressed about what's going on, I'm not going to skate around the issues.
Can we get to the question?
My question 4, which I noticed that the Leader is answering himself, not the portfolio holder for housing, but that's fine. Successive governments of all political colours have failed to build enough social housing or adequately replace the properties which have been purchased under right to buy. In particular, this has led to a chronic shortage of 3 or more bedroom properties in certain areas, including Berwick. What progress has this council made since 2017 in addressing the situation and providing hope to the many families in Berwick currently living in extremely cramped conditions?
Leader.
I'm really disappointed I can't answer this, but I have passed this one on to my portfolio holder for community services, John Riddle.
Thank you, Chairman. This question actually, as it was written to the Leader, so I'm very happy to answer it. Northumberland Council does not hold social housing stock in Berwick, as the former Borough Council was transferred its housing stock to the Housing Association before the Unitary Authority was formed. The right to buy doesn't apply to housing associations in the same way that it would to council tenancies. There is a right to acquire for housing association tenants, but the discounts are less and the incentives are reduced. Data that we hold indicates that there are approximately 1,260 socially rented homes in Berwick, with Benicia being the largest stock holding housing association. It is right to acknowledge that there is a shortage of larger family homes in Berwick area, and we are working very closely with them to address this for the Northumberland residents. We understand that this can be challenging for some families. In terms of new provision, the last social housing to be built in Berwick was completed in 2016. And although there are presently planning consents for 106 affordable homes across 5 development sites in and around the town, the mix of units will vary from scheme to scheme based on viability. We are developing a pipeline to provide new homes, working with MHCLG and the North of Tyne Combined Authorities to access our share of the 24 million of Brownfield Housing Fund that will bring new affordable housing stock into the county. The need to increase the supply of affordable homes is at the heart of our housing strategy, and we have ambitious plans to facilitate up to 1,000 new affordable units across this county. Development sites are being considered across the county on the basis of meeting local needs, and we have recently secured funding from Homes England to support the first phase of the new homes. The initial grant award of £920,000 will support the first true council housing to be built in a number of years. These sites already achieving planning permission at Embleton and Allendale, and a further site in Amble submitted for planning permission. Additionally, the grant will support a programme of up to 20 acquisitions this financial year on a purchase and repair basis, bringing much needed properties back into council ownership at affordable rented homes. The future pipeline of schemes includes potential development sites in Berwick, which are currently undergoing feasibility assessments, and we are working in partnership with developers and registered providers in the sector to bring these proposals forward.
Councillor Hill, do you have a supplementary?
Just to ask, and you touched on it towards the end, John, that you will continue to have at the forefront of your thinking the very chronic shortage in Berwick, and you'll continue to help fight the corner for residents in Berwick who are living in these cramped conditions.
I have said that, yes, and I do acknowledge particularly the larger homes, 4 bedrooms and above, that is where we find the main shortage in Berwick. And if properties come on the market that will satisfy that need, and we have a need for them, but we have a need across other parts of the county for these as well. Each one we looked at on a case-by-case basis, but it's certainly quite feasible that we will acquire properties where there's gaps.
Thank you. That draws an end to questions. So I move to the next item on the agenda, which is item 9, notice of motion, but I think Councillor Dickinson might wish to say something about that.
Thank you, Chair. We are intending to withdraw this motion and place it on the next council agenda when it's had some amendments made to it. Thank you for your time.
Thank you, Councillor Dickinson. So I'll move straight on to, we've done number 10 to number 11, to committee appointments and outside body places. To consider a number of appointments to committees and outside body places as a result of recent changes, including the appointment of the chair of the Facts and Health and Wellbeing Overview and Scrutinies Committees. These will be circulated in due course in terms of full appointments, which we will put in the week, more than likely. And if any group leaders wish to communicate any information on that, can they do so ASAP if they have any changes? But for now, we need as a council to agree that Councillor Mark Swinburne becomes the chair of the Family Children Services Overview and Scrutiny Committee, that Councillor John Bainan becomes the chair of the Health and Wellbeing Overview and Scrutiny Committee, and that on the Facts Committee, that Julia Parkin is replaced by Lynn Horton of the NASUWT. Are we okay to agree to all of those three changes? I'm taking that as a yes. I'm not seeing any dissent to that, so I will take that we have approved that. Councillor Dungworth, beg your pardon.
Sorry, Chair. Councillor Dixon has been trying to raise his hand.
I do beg your pardon. Councillor Dickinson.
So could you take Councillor Dickinson, please? Thanks.
Yes, Councillor Dickinson.
Thank you, Chair, and indulge me for a moment if you would. I won't get the new leader any more angry than he was before, because I don't want him to be the shortest lived leader. In relation to communication around the committee places, can I have assurance from the new leader that we're going to go back to the approval mechanism of leaders agreeing things rather than just tossing the constitution to one side? And the second point would be, now that we have a equalities champion within the cabinet, I'm assuming that some of these positions may be reviewed to include more women.
Councillor Sanderson.
Well, I thank him for the question. I wasn't actually angry at all. It's just I just feel I need to make my point sometimes with some councillors. I thank you for your question. Can I say to you that we will look at this in detail, Councillor Dickinson, and come back to you on that.
Yeah. And Councillor Dungworth, did you still have a point to raise?
Yes, I did. Thank you. What Scott was also going to tell you was that we will let Democratic Services know of any changes to our committee membership, if we have any, as you would do normally at this time of year. And I want to reinforce Councillor Dickinson's remarks, and let's see a few less grab caps and a few more dynamic women in the team, please.
Duly noted, Councillor Dungworth, and I will email you in respect of my position as business chair in the week as well, and to other group leaders and non-aligned councillors. Thank you. Councillor Hill, did you have your hand up as well?
Thank you, Chair. I've had a couple of messages from members of the public who had tuned in to hear the motion that's been withdrawn. Out of respect for them who've sat through the meeting, can we have further explanation? Was there any legal advice given to say why we couldn't discuss this motion? By whom? Did they have any interests at all?
If you wish to answer, Councillor Liam, beg your pardon.
All I can say, Chairman, is the motion is now withdrawn, the item is closed, and you're now on item 11. So
okay.
I have no comment.
Sorry, we can't hear.
Do you wish to speak up?
Sorry, can you hear me now, Councillor Dungworth?
Yeah, just.
Apologies, I will try and, without shouting, I'll try and speak as loud as I possibly can. All I was saying was that the motion has been withdrawn, and the item has been closed. We have moved on to item 11, so therefore it wouldn't be appropriate for me to comment in relation to that particular item.
Absolutely. I think that you are probably going to hear about this in due course, probably at our next meeting. It will no doubt be discussed in more detail. And I'm just going to ask Councillor Dickinson, you have your hand up. Can I ask what's in relation to?
Sorry, Chair, I was just going to offer an explanation, but you've moved on.
Okay, fine. Well, that's fine.
Chair, I just need a bit of clarification. You said something about you'd give your decision and circulate members. I'm not assuming you have a decision to make on group's recommendations for committee membership.
I certainly didn't. If you may have misheard me, or I may have
That's fine.
I don't believe I've said that.
I'm
Okay.
a bit paranoid at the moment, as I'm sure you appreciate, but I might have misheard it.
Okay. Okay. Councillor Dale, have you got a hand up for a point of order or such like? And because I want to move progress. You're on mute again, Councillor Dale.
Somebody keeps on doing the other thing to me. Could I just ask you that as we're going through difficult times and we'll need regular updates, if all members could have at least a weekly update online. There are some of us who are not actually on any committees apart from the area committees. And, you know, we all are representatives of people. I just think
Councillor Dale, the leader, I think, wants to come in here.
Absolutely great, thank you.
Yeah, thank you, Mr. Chairman. Yeah, I just want to give the assurance that I would like to go on as we've begun and have regular briefings. What I would actually quite like is if members could come back to me or to Kelly and say, these are very good, but could we have them in a slightly different format, or do you want it in bullet points, or, you know, but it's very much my wish that we do that. And actually I think we need to see how things are in a week or 10 days, and might be necessary to have another all-member briefing if that's what, you know, a workshop session with all members, if that's something that members would like. Would be more than happy to look at that if that is the general consensus. But I think we should see how we are a little bit farther down the road, maybe in a week or 10 days. Thank you.
I'm being extremely generous again. Councillor Dungworth, you got your hand up.
Thank you, Chair. I just would like the leader to consider maybe reinstating monthly council meetings during this period. You know, we're going to be in isolation effectively as members for the foreseeable future. And I just think that is a good way both of informing members of what's going on, but also of informing the general public.
Councillor Dungworth, I'm going to take this one myself. I'm the new business chair. Can I invite you to send me an email about that at your leisure?
I will do.
Thank you. Okay, on that, I will close the meeting. That's all the items. Thank you very much for your sorry, I'm just having some speaking next to me. I believe we've covered all appointments. So in that respect, I will close the meeting and thank everyone for their patience in this era of Zoom meetings. Thank you very much. And I will end.